Welcome to our humble channel. This is a lecture entitled Point of Care Ultrasound for Rural Emergency, presented by Dr. Jelani Ali. Firstly, let's discuss the various types of ultrasound teaching. 1. EDE, Emergency Department, Echo. 2. E-FAST, Extended Focused Assessment for Shock Trauma, Extended Focused Assessment with Sonography for Trauma. 3. RUSH, Rapid Ultrasound for Shock and Hypotension. 4. POCUS, Point of Care Ultrasound, the general term for physicians using bedside ultrasound. Secondly, the type of transducer. 1. Linear probe, frequency shallow but good resolution for superficial structures. 2. Phased high, frequency shallow penetration, good resolution mainly for cardiac. 3. Curvilinear, frequency good penetration, used for abdomen and E-FAST. Now let's talk about POCUS. Point of Care Ultrasound is the general for physicians using bedside ultrasound, cardiac substernal, aortic scanning, abdomen free fluid, pleural view for detecting fluid in the chest cavity. Cardiac substernal. There are 3 views of the heart: substernal, parasternal, long, and apical 4-chamber. We will only consider the substernal view for now. It is intended to look for 2 things: pericardial effusion, cardia standstill right, ventricular dilation massive PE, CHF ventricular contractility. Technique: substernal, used a curved array probe. Set depth to maximum, 24 to 28 centimeters. Start with the probe completely flat on the abdomen indicator to patient's right side. Start just above the umbilicus. Slowly slide up toward the sternum, watching for beating. Identify the pericardium. Should be able to see the right ventricle and septum. Aortic scan. Technique: place line of gel from xiphoid to umbilicus. Using curved array probe, placed with indicator to patient's right, transversely and perpendicular to abdomen. Start right against the xiphoid sternum. Landmarks and identifying the aorta. First landmark is the thoracic spine. Aorta is located immediately anterior to the spine and usually slightly to the patient's left. The IVC is usually located to the right of the aorta. Aortic wall is thicker than the IVC and is usually round, whereas the IVC can be teardrop, curved. Aorta is non-compressible like the IVC. IVC will collapse. Aortic scan for abdominal aortic aneurysm, AAA. What is a positive AAA scan? A positive AAA scan refers to any segment of the aorta that measures greater than 3 centimeters in its antero-posterior AP diameter as measured from the outer wall of the aorta. This finding is significant when observed in a patient who presents with abdominal pain and exhibits clinical symptoms consistent with a potential ruptured AAA. If you are unable to visualize the whole aorta from xiphoid to iliac bifurcation, the scan is indeterminate. If you see an area of the aorta that is greater than 3 centimeters in AP measurement, that is a positive scan. Certainly. Let's discuss abdomen-free fluid and pleural view for detecting fluid in the chest cavity. 1. Pericardium. 2. Right upper quadrant. 3. Left upper quadrant. 4. Suprapubic area. 5. Right anterior thoracic. 6. Left anterior thoracic. Abdominal scan for free fluid. 80% of significant bleeds will be detected in the RUQ, Morrison's pouch. So always start there. Blood and fluid from the pelvic, abdomen, and LUQ will all drain eventually into the RUQ. Hemoperitoneum. Morrison's pouch is a common site for blood to accumulate when any solid intra-abdominal organ has been injured. Free fluid appears as an anechoic stripe in Morrison's pouch or within the right paracolic gutter. adjacent to the lower pole of the right kidney. In the perisplenic region, free fluid appearance and location are similar to the description for the perihepatic area. Free intraperitoneal fluid appears as an anechoic stripe in the subdiaphragmatic space, splenorenal recess, or the left paracolic gutter. Since the splenorenal recess is not the most common site for free intraperitoneal fluid to accumulate in the left upper quadrant, it is essential to visualize the left diaphragm and left subphrenic space. Early splenic injury will be detected in the LUQ. Free intraperitoneal fluid often accumulates in the pelvis because it is the most dependent area of the peritoneal cavity. Liquid blood or ascites floats above the bowels and will be located adjacent to the bladder and anterior peritoneum. Blood clots in the pelvis are located in the cul-de-sac and may distort the contour of the bladder. Free pleural fluid. The right or left diaphragm appears as a bright hyperechoic structure. Free pleural fluid can be identified as an anechoic stripe, superior to the diaphragm. Pneumothorax. Sensitivity of POCUS. For pneumothorax is around 86-98%, 35-75 for CXR. Use linear array probe at the 4 to 6 interspace in the mid-clavicular line. Curved array probe can be used, especially if you can set the frequency high. What to look for and what is a positive scan? Lung sliding, comet tail and lung rockets, M mode, lung point. Interstitial lung fluid. In a normal lung, you will see A lines, which are horizontal lines from ring down artifact of the pleural. With interstitial fluid or consolidation, there will not be A lines. In pneumonia, fluid, inflammatory and pus, fills the alveoli. In early pneumonia, the fluid-filled alveoli are surrounded by air-filled lung, and B line often result. Technical difficulties with the FAST examination. Most clinicians have little difficulty locating Morrison's pouch, but have greater difficulty locating the splenorenal recess and left pleural space. With some patients, visualizing the pericardium can be difficult. Breathing or ventilation can interfere with the examination from lung or rib artifact, or enhance the examination. When it brings organs closer to the ultrasound probe, diaphragm, heart, liver, spleen, or kidneys. Fluid in a partially emptied bladder can be mistaken for free intraperitoneal fluid. Thank you for watching. We hope that this video has provided you with valuable insights and knowledge about point-of-care ultrasound for rural emergency. If you found this video helpful, we encourage you to like, comment, and share it with others who may benefit from the information. Additionally, consider subscribing to our channel to stay notified about future educational content. Thank you for your support and interest in North Star's ultrasounds. Stay curious, stay informed, and take charge of your health. Until next time.